Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Acute CHF, and let's look at its management. So first of all, the congestive heart failure. They are of two types. So they can be acute and acute congestive heart failure, or it can be the decompensated heart failure, and the other one is the chronic congestive heart failure. So chronic heart failure we discussed in another video, or it is known as a compensated heart failure. So the management in case of the acute heart failure, there is three aspects to it. One will be the reduction of edema, then comes decreasing the workload of the heart, then comes the increasing working capacity, so increasing the working capacity of the heart. So now let's look at the drugs. They are used in various aspects. So drugs in reduction of the edema. So what are the drugs in reduction of edema? The most common will be the loop diuretics. So loop diuretics are used for the reduction of edema, example being the furosemide. Next comes the mannitol. The mannitol, if you see, is a CI, that is a contraindication in case of the left ventricular failure and also in case of the pulmonary edema. So what are the drugs used in decreasing the workload of the heart? So decreasing of the workload of the heart, the most common used is the vasodilators. The commonly used vasodilators include the nitroglycerin, the sodium nitroprusside, and also the route of the drug administration is going to be purely IV. Next is the nicertide. The nicertide is nothing but a BNP. BNP stands for the brain natriuretic peptide. So this analog is used, and another thing is it is not given orally. So not given orally, and it is only given IV. So this stimulates, this nicertide, it stimulates the guanine cyclase, so which increases the cGMP. So it increases cGMP and causing the vasodilation. Then lastly we move on to the drugs which increase the working capacity of the heart. So drugs which increase the force of contraction, increase the force of the contraction. This includes the beta 1 agonist. So commonly used, most common ones are the dobutamine, then dopamine, as well as the noradrenaline and the adrenaline. So these include the increase the force of contraction of the heart. Next comes the group of phosphodiesterase 3 inhibitors. So they are aka the inodilators, and the drugs used in this case are the amrinone, the imandrinone, the milrinone, the enoximone, as well as the vesnarinone. Then looking at the calcium sensitizers. Calcium sensitizers, there is what they do is they sensitize the binding of the calcium to the troponin C. So the drugs used are nothing but the levosimendan and also the pimobendan. Then looking at the cardiac glycoside, so these inhibit the sodium potassium ATPase pump. So it leads to nothing but the influx of the calcium ions. This is into the cardiac myocyte, which leads to the increase in the force of contraction of the cardiac muscle. Next is the digoxin. It is only the cardiac glycoside available. So this is an important drug. To learn and grow daily like this, please do subscribe.